Hello everybody, I am Dr. Somasekhar Rao, gastroenterologist and hepatologist at Apollo Hospitals, Jubilee Hills. Today it's a World Hepatitis Day and I would like to talk about the importance of World Hepatitis Day and what are we trying to do with this World Hepatitis Day. See, basically 28th of July is celebrated as World Hepatitis Day to bring awareness in general public about the etiology, causes of viral hepatitis and how they are spread and how we can control these infections. So, this plays very important role in controlling all these viral infections and eradicating these viruses from our country actually. So, basically what does the word hepatitis mean? The inflammation of liver cells is called hepatitis. So, there are various causes of hepatitis and the most important among them is viral causes. There are various viruses from A, B, C, D and E which infect the liver and cause viral hepatitis. Among them, there are two types of hepatitis called acute viral hepatitis and chronic viral hepatitis. So, few of these viruses which infect the liver will be cleared by themselves, but they manifest as jaundice like yellowish discoloration of eyes, urine and generalized weakness, low grade fever, nausea and vomiting. And these are called acute viral hepatitis presentation. It is most commonly caused by hepatitis A and hepatitis E and sometimes by hepatitis B also. But these viral hepatitis which present as acute viral hepatitis doesn't cause any chronic damage. Occasionally they may cause damage called acute liver failure, which we need to be very careful, but most of the time they are acute and self-limited. And the spread of these viruses is most commonly by water and food. So, basically clean water and clean food is the most important thing to control these infections and prevent them. There is a vaccination for hepatitis A, but it is not recommended in Indians at least, because most of us are already exposed to hepatitis A and obviously there is no need for vaccination for hepatitis A. And hepatitis E, it has an importance that in third trimester of pregnancy, that means during the last 3 months of pregnancy, if any pregnant female gets these viruses, there is a higher risk of acute liver failure in these patients. So, all pregnant females should be very careful with the type of food and water what they are drinking to avoid acute hepatitis E. And actually at this point of time there is no vaccination available for hepatitis E in India. Very soon it will be available in India. So, at this point of time prevention is the only thing what we can do. So, I would suggest everyone to avoid acute viral hepatitis. We should be very careful with our food and water. And there is one more type of hepatitis what we are talking is a chronic viral hepatitis. Most commonly it is caused by hepatitis B and hepatitis C. See, if you know how these infections come, then we can will be able to avoid and will be able to know about these viruses. See, basically these viruses like hepatitis B and hepatitis C are transmitted parenterally. It's not the enteral route, it's parenterally. Most of the time this is from the intravenous route like blood transfusions or any whichever syringes which are reused, needles which are reused. In most commonly we will see these in IV drug abusers. So, it can also be transmitted sexually also. So, all these things play an important role. We should be very careful in avoiding these infections. So, what is hepatitis B and hepatitis C? So, these are chronic hepatitis viruses which which cause infection of the liver and they cause permanent damage like cirrhosis of liver and liver cell cancer. So, how do we avoid? First and foremost thing is prevention. All of us should be aware of these things and most importantly hepatitis B has a vaccine. So, once you are vaccinated, the vaccination has 3 doses. If you are vaccinated, 99.5% of the time you are safe from this virus, you will not get this virus at all. And when we know the modes of transmission, if you are very careful in avoiding these modes of transmission, you will not get this infection. And if anyone has this virus, yes, there is treatment. you can get this virus treated, and the treatment is depends on whether the virus is infecting your liver or not. So, once you are found to have hepatitis B virus, so all of us you should meet your hepatologist, and if necessary there are medications which can cure these virus. Definitely hepatitis B needs treatment if it is causing liver inflammation. And the second thing what we were talking about was hepatitis C virus. This is also a chronic viral virus which damages the liver, and this also causes cirrhosis of liver and liver cell cancer, and hepatitis C is curable. The only chronic virus which can be cured is hepatitis C. With the recent introduction of new drugs, the treatment rates and the cure rates are very high, more than 90 to 95%. So, if you come to know that your hepatitis C virus, treatment is available and you can be cured. So, most important thing is knowing about these viruses, acute viral hepatitis or chronic viral hepatitis. All of you please know about these viruses, get yourself checked for hepatitis B and hepatitis C, because these viruses will not give any symptoms, they will damage your liver slowly, and only after the liver is completely damaged you will come to know that there is some problem. So, all of you please know your status of hepatitis B and hepatitis C, please get checked. At Apollo we have started this awareness program so that all of us will come to know about these viruses and get yourself checked, and we at the Department of Gastroenterology and Hepatology, we are promoting this awareness program because it is very important, and on this World Hepatitis Day we would like to bring more and more awareness regarding this chronic viral hepatitis which are dangerous to the life, and if we know about them it is definitely treatable and curable. So, all of you please know about these viruses, get yourself checked.